Can you imagine music playing in your ears 24/7? Imagine a song from Celine Dion is playing over and over again in your head with no control over it. Whether this sounds pleasant or not, it can really happen, and in the medical literature, it's referred to as musical ear syndrome. An example of this syndrome was an 87-year-old female who reported hearing a concert playing for a month. She initially thought it was coming from the neighbors next door. However, she eventually found out that she was the only one hearing it, as others coming to her home denied hearing such music. This is exactly what we call musical ear syndrome. The syndrome consists of complex auditory hallucinations during which the patient hears songs or melodies in the absence of any external audio source. Despite having the label of being hallucinations, most affected individuals are aware that the songs and melodies are not really there. This is in contrast to most hallucinations that occur in psychiatric patients who lack insight and believe the sounds and voices are real. Although some patients with musical ear syndrome have psychiatric conditions, most have no previous psychiatric issues. In fact, most causes of musical ear syndrome are a result of organic etiologies affecting the ears or the auditory pathways to the brain. The exact mechanism behind musical ear syndrome is not clear, but some believe it is a type of release phenomenon. See, what happens is that normally there is a constant input or impulse from your inner ear hair cells through the auditory pathways to your brain. If for some reason part of this pathway is disrupted, your brain will not receive the inputs it usually gets and expects. In this situation, your brain might replace the absent input with something else, which in turn might be your favorite song. In better words, your brain has released sounds from your memory to fill the gap which was previously filled by the impulses coming from your ear hair cells. This is what we call release phenomenon. In one sentence, the sensory deprivation stops inputs into the auditory system, causing spontaneous activity to occur. This is probably why some patients with musical ear syndrome have improvement in their symptoms when we maximize their hearing with a hearing aid or enrich their environment with sound. These measures will probably give the brain the much needed input to reduce its own generated sound. Although musical ear syndrome is not a scary disease and in fact might be pleasant to some, it can still be disturbing and affect their quality of life. The exact prevalence of musical ear syndrome is unknown. They are thought to be underreported as patients are concerned about seeming crazy or because the hallucinations are not bothersome. It is interesting to know that the cause of the musical hallucinations can impact the music heard. For example, in patients with dementia or a disease directly affecting the ears, the songs heard were mainly related to childhood. Patients with structural brain lesions commonly heard modern music, and patients with psychiatric causes tended to hear more sad or scary music. Anyway, whether rock, country, pop, or sad music, musical ear syndrome really exists. And if you feel your neighbor is playing non-stop music 24/7, you might want to double check on that.